Some of the conditions that I mentioned previously, there is a great debate as to the cause or the etiology of these conditions. Something as simple as a hammer toe or a bunion can have a multitude of causes. Some experts feel that there's a genetic component to this. Some feel that it's a purely biomechanical issue. Some people feel that it's a combination of both. I think I would agree with the latter, that there's influences from shoe gear, work conditions, the way the feet are treated on a daily basis, as well as some degree of a genetic predisposition for these conditions to occur. Certainly, there are certain pathologies or injuries that have certainly no genetic predisposition and are unavoidable. But in general, wearing good stiff-soled shoes, wearing proper inserts and supports, and generally taking good care of your feet is very, very important. Another one of the most common conditions that we see as a foot and ankle surgeon is something called plantar fasciitis. And a lot of people confuse plantar fasciitis with what they call heel spurs. They're somewhat related, but if you look at the medical literature, the heel spur forms typically as a result of the plantar fascia being inflamed and symptomatic. There are two avenues of treatment, and for me, we certainly propose a conservative approach first. That can include ice therapy, physical therapy, inserts for the shoes, appropriate stretching and physical therapy, and cortisone injections. In addition, you might be immobilized with a fracture boot or a night splint over a period of time and given some anti-inflammatories to help reduce the inflammation. Now, if this condition does not improve over time, in a reasonable amount of time, the next step certainly is to fix it permanently with surgical intervention, and that could be either through an endoscopic minimal incision approach to partially release the area that's affected, or through an open approach where part of the plantar fascia is actually cut and your problem ends up being solved through an open approach. Either way, I think you end up with very good results, and the pain of the plantar fascia is mitigated significantly.